Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's briefing. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Today we're reporting one new case of COVID-19. That case is in Central Zone and is close contact to a previously reported case. There are 27 active cases in our province. Our case numbers continue to remain low, and I want to say thank you to everyone for that. You are working hard to follow the protocols, and it's showing. We are concerned about the high number of cases in other provinces, specifically Alberta, where many Nova Scotians are working. These are our rotational workers who split their time between two provinces. A number of our cases are connected to rotational workers. Currently, when they come home, they are expected to get a test within the first day or two of arriving home, and then again within a week of being home. Not all rotational workers are complying, and that's a problem because if they are symptomatic and going out without a test, they could be unknowingly spreading that virus. So we had to make a tough decision, but we believe it is the right one. Effective Friday, it will be mandatory for all rotational workers to get tested. Audits will be done, and if they do not get their first test, they will be called and reminded to get their second test. And if they do not get their second test, they will be fined $1,000 for that. Rotational workers are supposed to follow the 14-day modified self-isolation, and now with this mandatory test policy, it is our hope that we can identify COVID sooner and slow the spread and reduce our cases while we continue to roll out our vaccine program. Today, the first doses were given to our frontline healthcare workers in the Western Zone, and yesterday, frontline healthcare workers in the Cape Breton Regional Hospital received their first doses. And our vaccine rollout strategy branches out to our long-term care facility as well, starting with Northwood. As long as the vaccine continues to roll in weekly, our strategy will continue to roll out across the province. It will take time, but we will get there, and we thank you for your patience. Over to you, Dr. Strang.
Thank you, Premier, and good afternoon, everybody. Before I start, I just want to recognize Doug Strickland, who is 102 years old, lives in North Sydney. This is the tie of his regiment, the West Nova Scotia Regiment, and he served in that with that regiment throughout all of World War II. So I wanted to recognize you, Doug. Thank you for your sacrifice and the example that you provide for all of us as we work together to battle COVID. As the Premier said, today we are reporting one new case of COVID-19 in Central Zone, and that person is a close contact of a previously reported case. Since October 1st, there have been 445 cases in total, and 418 of those are considered resolved, so we now have 27 active cases of COVID-19 across all 4 health zones. Unfortunately, no one is in hospital. Our numbers continue to be encouraging, with most of our cases being linked to previously known cases or travel outside of the province. And we've seen a day recently with 0 cases, and again, only 1 today. So while this is great news and encouraging, we cannot get complacent. We are still not quite at the 2-week mark from New Year, and we're only a few days into public school students returning to the classroom and post-secondary students coming back to the province for their second term. Most of the rest of Canada is in the middle of an intense second wave, with substantial health impacts and requiring far stricter restrictions than we have in Nova Scotia. Earlier this afternoon, Ontario declared a state of emergency, and they have imposed a stay-at-home order across their province. So while I know it's hard to do, even though our numbers are low and stable, we have to continue our cautious approach. What we are doing is working, and we want and need that to continue. So I'd like to move on and provide a brief update on our immunization efforts. So since we administered our first vaccine in Nova Scotia on December 16th, our total number of delivered doses is now 3,831. Most of those are people with their first dose, but we have begun to give some people their second dose as well. As the Premier said, yesterday was a milestone moment in our immunization campaign when we delivered the first COVID vaccines outside of the Central Zone. The vaccine is now in Cape Breton, and the first clinic was held yesterday at Cape Breton Regional Hospital for healthcare workers, both hospital workers and local long-term care facilities as well. Today, there is a similar clinic at the Valley Regional Hospital, so the first healthcare workers in the Western Zone are beginning to receive their vaccine. And the first clinic in Northern Zone will be launched next week. In addition, the first clinic outside of a hospital setting was also launched yesterday when we began at Northwood's Halifax campus, and the first long-term care residents in the province received their vaccine. We all know how hard Northwood was hit during wave 1 of the pandemic, and I'm very happy that we were able to start vaccinating those residents and staff. It's also the first time we administered the second vaccine, the Moderna vaccine. And later this week, we're expecting to receive 2 shipments of vaccine, 5,850 doses of Pfizer vaccine and 3,700 doses of Moderna vaccine. Some of this vaccine is designated for the cold storage site at Colchester East Hants Health Center. And as I said, that's where we'll begin the first immunizations in the Northern Zone. And we will also see more long-term care facilities in Central Zone beginning to offer vaccine as we expand to Shanx Parkstone Enhanced Care tomorrow, Northwood Bedford campus on Friday, and Ocean View on Monday. And we've also identified 2 long-term care facilities in Cape Breton who are preparing and training staff as we speak. So we expect immunizations to start at Northside Community Guest Home and Shanx Harborstone Enhanced Care in Cape Breton next week. As I mentioned last week, there have been many groups reaching out wanting to be first in line to receive the vaccine because of their jobs or medical status. And again, I ask people to please be patient. We know who is at the highest risk of getting COVID-19, getting severely ill, or dying. Along with healthcare workers, these are the people who will receive the vaccine first when we're able to move beyond our phase 1. The federal guidance is very clear on this, and that is what we will be following. And that's why when we get to the end of phase 1 into phase 2, we will start to immunize people who are 80 plus who live in communities. And before I leave the vaccine update, I want to talk about volunteers. We've had a lot of questions about how people, or about how we will staff the vaccine clinics. We've had a lot of people saying they'd like to volunteer, and we've said we'll need volunteers. So I'm happy today to say that the Nova Scotia Health Authority now has a posting on their website so that people will know exactly how they can volunteer. And in the government, we'll be making sure that we share that information on our website and through our social media channels. So there'll be lots of opportunity people for now to start to understand what volunteering entails, and the many interested volunteers can start to put their names forward. And I thank everyone who's willing to do that. As the Premier said, on December 18th, we started with voluntary testing for rotational workers. And unfortunately, we have not seen as much as uptake as we would like. To date, we've only had about 1/3 of our rotational workers getting tested. We fully understand that the pandemic has been particularly hard on these rotational workers and their families, but we also know that there have been cases among rotational workers, and they continue to have a significant risk of importing the virus into Nova Scotia. Since December 1st, 21 of our overall cases, or 9.4%, have been rotational workers. As a result, starting this Friday, January 15th, testing will be mandatory for rotational workers who work outside of Nova Scotia, Prince Edward Island, or Newfoundland and Labrador. They must get tested twice, once on day 1 or 2 when they get into the province, and again on day 6, 7, or 8. And they have to complete their full 14 days of modified self-isolation, even if they have negative test results. That's because a negative result on one of these days is not definitive, proof of having no infection. However, it is an important step in detecting infected rotational workers before other people in their home become able to spread the virus when they themselves are out in the community. So the testing of the rotational workers is critically important, and that is why we're making it mandatory at this point. And I want to stress that we're not blaming or looking to single out rotational workers. We appreciate and acknowledge that the work they are doing, leaving Nova Scotia to earn a living for their families, but also contributing to our economy, and it's a necessity. But by making the testing mandatory, we're trying to protect rotational workers, their families, and our communities from the virus. So this testing is an added layer of protection for them and for us. Audits will be done to check testing data for randomly chosen rotational workers. And if the worker did not get their first test, they will get a phone call reminding them of the mandatory testing and the need for their second test. But if they do not get their second test, they will be issued a $1,000 fine. So rotational workers can book their appointments by completing the online self-assessment. They should not go to pop-up or drop-in testing sites. They must be tested at primary assessment centers simply because we need them to be using the PCR test and not the other rapid antigen test. But they need to make an appointment. They can't just drop into one of these centers without that. In terms of testing updates, in December we began to test staff of long-term care facilities, mainly in Central Zone and some facilities in the Valley due to the poultry farm outbreak. This testing has been and remains voluntary. And to date now we've expanded that testing to 29 long-term care facilities, and we're moving that into Western, Northern, and Eastern zones as well. Of the 29 facilities, long-term care facilities that we are currently testing, some of them have adopted self-swabbing, where the staff are able to test themselves. In others, they have designated staff who collect the specimens. We're also working with transition homes and shelters to ensure that their staff are using one of the existing testing streams to be tested, regardless of where they are in the province, to minimize COVID being introduced into these shared living facilities, with the knowledge that those who need to use the shelters are at increased risk if they do get COVID, and because of their shared living environment, there's an increased risk of an outbreak. And we're also working with community organizations to increase access to testing for the people and families that these facilities serve. In our correctional facilities, all inmates are being tested upon admission. Starting January 18th, we will begin testing any staff who want to participate in the testing program at the Central Nova Scotia Correctional Facility in Dartmouth, and then we will be phasing in testing in our other provincial correctional facilities in the weeks ahead. And lastly, we still have both our symptomatic and asymptomatic testing available at primary assessment centers across the province. So for all Nova Scotians, if you feel unwell, please do the online self-screening right away and get direction on whether you should be tested or not. And for people who do not, even if they don't have symptoms, you can still get a test, and this is most important for people who have a lot of interaction with others because of their job or their social activity. And for either one of those, you can go onto our online self-assessment tool and book a symptomatic or asymptomatic stream, and you'll get direction about testing from there. We also continue to have our pop-up sites around the province. Because they're a rapid test, you have to be 16 or older, so if people are 16 or older, you can get a rapid test at these sites with no appointment. The dates and locations are always posted on the Nova Scotia Health Authority website around those scheduling. The test itself is quick, and you can get your results in a matter of minutes. I've got a mix-up in my pages here, so... We're also working with the Restaurant Association of Nova Scotia on another innovative response to COVID. Today, the Restaurant Association of Nova Scotia has rolled out an electronic tracing app for all restaurants across the province who want to use it. It will be a simpler, easier way to collect customer contact information in case public health needs to reach them about a case. And I thank the Restaurant Association for their leadership in this area. It's another step taken to ensure restaurant staff and patrons remain safe. After Friday's announcements around tightening the border with New Brunswick, a number of questions have come in that I'd like to clarify. By and large, the rules that have been in place for travelers from outside Atlantic Canada apply to people coming from New Brunswick. For most people, you must complete the Nova Scotia Safe Check-in in advance, self-isolate for 14 days when you arrive, and respond to the daily email confirming that you are isolating as required. But there are just a few differences for New Brunswick that are necessary because so many people live on one side of the border and go to work, school, or have medical appointments on the other. And we've been working with New Brunswick on this. So we brought back the approach that we took in the public health order during the wave 1 before we had the Atlantic bubble. Healthy people who need to routinely travel back and forth over the land border with New Brunswick for work or for school do not have to self-isolate when they come to Nova Scotia. They do not have to complete the Nova Scotia Safe Check-in. They will get a chit from the border staff to display on their windshield, so they don't need to stop at the checkpoint. They'll get that on the first time they stop and explain their situation to border staff. For people who are looking for this, their travel has to be routine and ongoing. So if you only come for something like an occasional business meeting, then you do not get a chit and you would have to self-isolate for 14 days. But we have a lot of people who live on one side of the border and work on the other side of the border. Also people who go to school. There's a number of students who live in Amherst and go to Mount Allison, for example. So all of those people will be eligible. They can get the chit the first time they cross the border. For other folks, we would, we recognize the challenges, but we need to have the 14 days. If we would encourage people to look at other ways that they could accomplish their business or meeting with family or friends using virtual technology rather than crossing the border and having to deal with the 14-day isolation. Also, we know that there are people who come into Nova Scotia from New Brunswick or sometimes go from Nova Scotia to New Brunswick for essential medical treatment. And so those individuals, plus any support people they may need to take with them, can make those necessary trips without self-isolating. We know that there are post-secondary students who are or will this week coming up making their way back from New Brunswick to Nova Scotia University after the holidays. Also there may be people taking their traveling from parents taking their adult children to a New Brunswick University. So if you're taking a student from Nova Scotia to New Brunswick for the winter term, as long as you travel directly into New Brunswick, don't stay overnight, and maintain physical distance and wearing a mask, and using things like touchless payment for gas, drive-thrus for food. As long as you follow those, travel directly there and back, and have no close contact, then you do not have to quarantine when you get back from dropping your adult student child off in New Brunswick. And if people are coming from New Brunswick to bring a student here to Nova Scotia, the same rules apply. If they travel directly, don't have close contact, then they're not going to have to quarantine when they're here. They will have to make sure that stop at the border and explain their situation to the border the staff. We understand that we made this change quickly on Friday, and that may taken some people by surprise. So we've had a number of people reach out to us, and we've worked our way through this. So if you're in New Brunswick, because you plan to do your isolation there before coming to Nova Scotia, and you started that isolation in New Brunswick before we announced the Nova Scotia isolation. If you follow certain steps, we're not going to require you to have a second 14-day isolation when you come into Nova Scotia. So if you were already in New Brunswick as of January 9th, you can either complete your isolation in New Brunswick and then travel directly from your isolation site to Nova Scotia and the location where you're coming to Nova Scotia, and then you won't have to do the 14-day isolation in Nova Scotia. You have to do that within 24 hours of finishing your isolation in New Brunswick. Otherwise, you will have to then start a second 14-day isolation. If you choose this option, you are going to have to complete the Nova Scotia Safe Check-in, and as I said, go travel directly to your Nova Scotia location. If you choose to come to Nova Scotia partway through your isolation, you can do that too and finish your isolation here in Nova Scotia, but you still have to travel directly between your New Brunswick location and your Nova Scotia location. We're trying to have a degree of flexibility to accommodate people whose plans may have been changed because of a rapid announcement. So this applies only to people who were started their isolation before we made the announcement. If you come to Nova Scotia now, if you come to New Brunswick now and isolate and then come to Nova Scotia, you are not eligible and you will have to do a second isolation in Nova Scotia because you would have been aware of that requirement before you started your New Brunswick isolation. And lastly, I've been hearing anecdotes that there are a number of parents anxious about getting sport competitions back up and running, given that we have loosened restrictions in other areas, and I'm certainly aware of a lot of discussion on this on social media. I understand that it's frustrating, but we must continue our cautious approach. People are saying kids can't do sports, which is wrong. They can certainly practice. They can train, they can do skill development, but we're not quite ready to have them get back to actual games and competitions yet. The games and competitions add another layer of interaction between teams, officials, and families. It's also at a time when we've just have kids going back to school, and then allowing games and competitions just adds another layer of kids interacting, kids from different schools and different communities interacting. So given that we just reopened our schools last week, we're not ready yet to add that another layer of exposure. As I said on Friday, one of our key priorities is having kids in school learning and doing everything we can to keep our community safe so they can stay in school. So I'd ask those people who are focused on what we don't have around sports to remind themselves how fortunate we are here in Nova Scotia. When we look around at other provinces, many kids can't even practice, let alone compete. Our kids still have the option to remain physically active while doing many team sports and practicing. So I ask that people focus on what we do have here. Look at the bigger picture and not just the one thing that you see as being important. We have flexibility right now that many others do not. So as we close today, I want to again thank all Nova Scotians for following the protocols and restrictions put in place to protect our communities and our loved ones. All we need to do is look around to see how quickly this virus can spread and the devastating impacts it can have. So please continue to remain vigilant by following public health requirements and all the things we've been doing for months around staying socially distanced, limiting our numbers, washing our hands, staying home if you're unwell, and when necessary, look for COVID testing. I also ask for people to continue to have patience with our restrictions and the public health measures, and as we roll out our vaccine program. We're asking a lot of Nova Scotians, and people are continuing to rise to the challenge. I want to thank them for that. By sticking together, we will get through this in the best possible way. Premier.
Thank you, Dr. Strang. Before I turn it over to Tina, I too want to recognize Doug Strickland, who spoke, and all vets. This year in November past, we couldn't stand at our cenotaphs and our individual communities, but I hope you all know that in no way underscores how important we know you have been to building this country, quite frankly, in building our respective provinces and giving all of us the resolve to battle COVID here in our province, understanding what you had to go through to ensure that we are still here. And as we sit here today, there are men and women in uniform, both in military and law enforcement uniforms all across the world, from Canada, who are representing us with the Canadian flag. I want to wish them good health and safety and thank them for their service. Tina.
Just a reminder, we'll take one question and one follow-up from reporters on the line in the allotted time for today's briefing. We'll start with Mike Gorman from CBC. Go ahead, Mike.
Thanks. Dr. Strang, you've talked before about the vaccine rollout plan, and of course that 50% of delivered doses will be held back for the second inoculation. But a lot of people are noting the vaccine trackers online, which are showing the amount of vaccine that we're holding above and beyond that 50% right now. I just wonder if you could talk a bit about the rollout plan and the effort to get those needles into arms as soon as possible.
So I think if we look at it, I went through a detail on what we're rolling out, but if we look at January, we stood up a single vaccine site here in Halifax in December. In January, we are standing up 4 other hospital sites, 6 long-term care facility sites. Each of those sites requires a significant amount of planning, preparation, training of staff, etc. So this is very big and complex, and I think it may. And I'll use the northern zone example. We're getting vaccine in the next couple of days that will go up to the facility in Enfield, the community clinic in Enfield. We'll start immunizing there next week. The reason it's taking a bit of time is that it's getting all the staff who are going to be immunizing up in that part of the province, getting them up to speed so they're fully trained, putting all the logistics in place. You have to remember that we are delivering as almost full healthcare services in our healthcare system on top of our COVID response, and then on top of that, again, we're layering the need to deliver vaccine. So while it may look that it's taking a little bit of time, it's the biggest, most complex healthcare initiative we've ever done in this province. And I really, we are rolling that out with the necessary logistics and training in a very timely manner. And again, if we step back and look at January, standing up 10 new vaccination sites, that's quite an accomplishment.
Go ahead, Mike, with your follow-up.
Thanks. On a different note, Premier, in 2020, Nova Scotia Power customers experienced an outage every single day of the year. And I wonder if you think that is sufficient service delivery for customers and what you make of Nova Scotia Power suggesting that that's actually progress in terms of their response.
Well, I'm sure I've heard Nova Scotia Power say, quite frankly, they weren't satisfied with that. I think all of us need to recognize vegetation management is a huge part of that. When you go across the province, there are many remote parts of our province that these lines go through that will require the continued making sure that we're doing the maintenance in terms of vegetation management. I also call upon all of us in our respective communities that when the sun is shining and our power is on and they want to clip the trees in front of our house, that we need to let them do that so they don't end up taking the power out in a winter storm. We all saw what happened with Dorian. Much of that was based on trees and vegetation. But they need to do better. I think they've acknowledged that. The piece of legislation, the Accountability Act that we brought in will help hold them to that. But I think we need to continue to improve the reliability of the system, and they're doing that.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. I guess I'm just, as we see cases in other provinces and the Premier spoke about his concern, in particular with Alberta, I'm just wondering, given the numbers that you gave, Dr. Strang, of the number of cases tied to rotational workers coming back, when we saw some red flags and maybe why these mandatory testing and the threats of fines weren't brought in sooner?
So you can always look back in hindsight. I mean, we always try to start with a key public health principle is you start with the least restrictive approach possible. So we worked with rotational workers. We initially started with a single test. Then we quickly moved to add the second test. But as we looked at our numbers in early January, really seeing that we're only getting a third. It took us a bit of time to get some robust numbers to see, well, how did our initial approach work? And clearly it wasn't sufficient. So I think we moved very quickly. Then we have to add on the extra piece of making that mandatory, because the initial approach clearly, we needed to give it a few weeks to show whether it would work or not. It hasn't, so we're moving now to make it mandatory.
Go ahead, Jesse, with your follow-up.
I guess keeping in line with looking at how things are playing out with cases spiking in other provinces, in particular our neighbor in New Brunswick. I think as of January 1st, we've seen 218 cases there. I'm just wondering if you've had chances in your conversations, either the Premier or you, Dr. Strang, to discuss with New Brunswick, what are we doing here perhaps that's protecting ourselves better against a second wave spike like we're seeing there? Is there any particular things that we can learn from New Brunswick?
So I've had a couple of conversations with I have weekly discussions with all the chief MOHs in Atlantic Canada. Certainly, and my epidemiologists are getting information from New Brunswick. What they are seeing is they're having two clusters of cases. One associated with social gatherings around Christmas, and then a second surge associated with social gatherings around New Year's. You can, whether, we're not going to comment on what New Brunswick was or was not doing, but I think the fact that we have not had the same surge, to me, I read that as that Nova Scotians had took seriously. We kept things very tight over Christmas. With good reason, and I think we're seeing why we did that. And I think Nova Scotians, by and large, followed that, understood why they needed to do that. To me, it's a lesson on our approach, which is to go very slowly and cautiously. And when things start to go sideways, we will tighten down very quickly, and then we'll loosen that very carefully. It's a message all about being cautious and careful, but to me it's also testament to how hard Nova Scotians continue to work to follow the public health restrictions and requirements to keep each other safe. So thank you to all Nova Scotians.
I just want to echo, I'm certainly not going to make a comment on what's happening in New Brunswick, other than sending my support, and Premier Higgs and his team have done a tremendous job from the very beginning of this pandemic, and I would say all Atlantic Canadians have. But I do want to echo what Dr. Strang just said about Nova Scotians, and this really is about you, the people of this province. By and large, all of you followed what we asked you to do at Christmas time and New Year's, and knowing how difficult that is, I'm really proud of the fact that Nova Scotians kept our family gatherings to a minimum. We made phone calls, we checked in on people. I'm really proud of that, and we're reaping the reward. So this isn't about what someone else anywhere else is doing, or what other premiers are doing, or what other public health officers are doing. It's about what you're doing as Nova Scotians, and you should be really proud of what you're doing.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. I just wanted to check in again, Dr. Strang, about the COVID variant. I know at the last press conference on Friday, you mentioned some samples were sent away to be tested at the national lab. Just want to get an update on that, whether or not we're seeing that now in Nova Scotia.
We haven't heard back on those samples. I haven't heard about any other samples being submitted. So, as of today, we don't have no evidence of a COVID variant here in Nova Scotia. If and when we do get one confirmed, you will absolutely hear that from us very promptly.
Go ahead, Natasha, with your follow-up.
Thank you. Given that there's a lot of misinformation floating around, especially online, about the COVID vaccine, I'm wondering if there's any kind of campaign the province is working on or plans to do to kind of combat that misinformation, let people know kind of the facts about the vaccine and the safety around it.
Yeah, we already have some of that information out there, and certainly it's a topic of substantive discussion with my colleagues in our communications team. Or just even yesterday, they had a discussion. We have the real value of and the privilege of having an international expert, Dr. Noni McDonald, who's still here working at the IWK, and they had a conversation with her, and I was briefed about that, and she was able to provide a lot of valuable insight. And so we are in the process of developing a much more robust communication strategy. The timing of that is important. When we're right now we're the limited vaccine with tight priority groups. We're certainly making sure that those priority groups get the necessary information. But as we roll out our broader vaccine program, hopefully we anticipate doing that in late April and May. We will certainly have a robust communication strategy out ahead of that to make sure that Nova Scotians all have accurate, fact-based information on this vaccine.
Next, we'll go to Danielle Edwards from Canadian Press. Go ahead, Danielle.
Hi, I just had a question about the resources that are going to be used to help track rotational workers and whether or not they're getting their 2 tests during their quarantine. I know there were some concerns about the resources and the manpower behind tracking people who traveled into the province and were having to quarantine. So does the province have enough manpower to make sure that rotational workers will be adhering to the rules?
Yeah, this is all done. First of all, its starting point is using our safe check-in form. So there's a stream in that where people identify as a rotational worker. We can then take that information and within the staffing that we have to do the work to select a random sample of those, match them up with information we have in our testing database, and we can identify whether which rotational workers that have been selected have actually had their first test or not. And then they'll be doing the phone call and, if necessary, the follow-up with local police. So we can do all of this within our existing resources. That was one of the questions when we asked, is it possible to do this audit check? And we clearly explored that, and we can certainly do that within the capacities that we have.
Go ahead with your follow-up, Danielle.
I also have questions about that portion of rotational workers you said aren't or weren't getting testing when it was just a voluntary decision on their part. How did you get information on whether or not rotational workers were or not getting tested?
So again, we went back to the same databases. So who was identified as a rotational worker in there through the voluntary safe check-in, and then we matched that up with the information and did they appear having a test result, positive or negative, in our database. And then when we did that work for looking for a number of weeks in December, when we looked at that very early in January, we saw that only a third of people who identified as rotational workers were actually having getting their COVID testing done.
Next, we'll go to Kathleen Jones from All Nova Scotia. Go ahead, Kathleen.
Dr. Strang, given that the first vaccines have been administered at both Northwood campuses, I'm wondering how many long-term care residents we can vaccinate per day at this stage.
So I don't have an exact number. That's going to depend on the capacities within each long-term care facility. Some of them have greater capacity than others. It'll also depend on how we're slowly increasing the number of long-term care facilities that will be able to be vaccinated. So I think I don't have an exact number, but what I am confident in over the next few weeks, we're going to see a growing number of long-term care residents immunized every week as we move from January into February into March.
Go ahead with your follow-up, Kathleen.
Dr. Strang, during today's Standing Committee on Health, Janet Hazelton explained the necessity to increase staffing in nursing homes so residents can get a minimum of 4.1 hours of care each day, which is considered critical to keeping residents healthy and safe. What will the province be doing to increase staffing levels and achieve this level of care?
So that's an answer really to, that's beyond my mandate, which is around public health and prevention, staffing in the healthcare system. There's many other folks I'm sure are looking at that and continue to work with our long-term care facilities and with the nurses union on that.
And we will continue, as we do every year, to look at the complement of services that we're providing in long-term care facilities, make sure that staffing levels are appropriate. The same thing we do as we look at our acute care system, ensuring that we have the capacity to be able to provide acute care services when required, and we will continue to work with our partners. So I appreciate Janet's point of view at the Standing Committee.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, I hear you on the pace of the vaccination rollout. It's early days, low numbers all the way around, both in terms of cases and vaccines received. But echoing Mike Gorman's comments, the public perception is, hey, Nova Scotia is, one of the worst in the country of getting this out. I don't think that's completely fair, but at this point, but moving forward, do you see a point where our percentages of vaccine delivered into arms will approach that of other provinces and regions, and when would that be?
So Tim, thanks for the question. I'm not really concentrating and focusing on what other provinces are doing. I'm working with my colleagues around, are we doing the right things here in Nova Scotia? We're two things. We're holding back 50% of our vaccine because we're in the fortunate position that certainly all the scientific advice, the advice from the National Advisory Committee on Immunization is, if at all possible, stick with the 21 or 28-day schedule between two doses. Other provinces are looking at having to stretch that out because they're in a much different situation with COVID, and they're trying to get as much first dose of vaccine in other people's arms. So we don't have to do that because of all the other things we've done to control COVID. So we can take the safest approach, which is to make sure that everybody we're focused on getting as many people with 2 doses of vaccine in a timely manner. So that's one of the things that feeds into why we may look different than other provinces. I think we also have to recognize, as I said, that and I've said this earlier, when we're not slow in vaccinating. We got vaccine on December 15th, and started going to arms on the 16th. Those people then became eligible to get second dose on January 6th, and we started to immunize them on January 6th. It may take a few days to get vaccine and ship it to a new site and then stand up the clinics, but all of this is because we're at the very beginning, and you can't go from 0 to 100 miles an hour overnight. We're standing up the most complex delivery program. As we introduce each site, we'll become more efficient and effective over time as we get more and more vaccine to those sites.
I want to reassure Nova Scotians that the vaccine that is coming into this province is going to the arms of Nova Scotians as quickly as possible. Public health has done something in this period of time of receiving the vaccine that I think is quite unique. Just like we did around testing, we diversified our testing model. We are setting up vaccination stations across our province. This may be a surprise to some. Not everyone lives in the capital city. We are vaccinating people in Cape Breton today because we took our time and now set up a system and we're able to put that vaccine there. We're vaccinating people in the Valley today because Dr. Strang and his team set up those protocols. Could we put that vaccine in someone else's arm quicker? Maybe. But the reality of it is we're about to receive in April through to April, May, and June 1 million doses. We want to make sure we have the infrastructure to put that vaccine in the arms of all Nova Scotians. And we're going to continue to do, and I'm going to continue to follow the good advice that I'm receiving from Dr. Strang and all those who are working in public health and those who are working in healthcare across our province to ensure that every Nova Scotian, regardless of where you live, can be reassured that your government and your public health officials are thinking about you as well. And we will continue to deliver the vaccine the way we have, which is a complex and a very diversified approach. And I want to assure you that you will receive a vaccine.
Go ahead, Tim, with your follow-up.
Yeah, just a quick question about the vaccine deliveries. Again, it's early days and there's only been a handful of them. But are they coming in a timely fashion? Are they coming in on a regular schedule when you expect them, or have there been delays?
No, we have not. We've gotten a schedule of vaccines, and certainly for January into February, it started middle of December, and so far we're getting the vaccines that we expect to get at the time we expect to get them. So the delivery into Nova Scotia is going as planned and expected.
Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thank you. A week ago, last Tuesday's briefing, my Coast colleague Victoria Walton asked about the change in university student testing, where it was in the fall 3 mandatory tests, and is now a single encouraged test for the winter term. And Dr. Strang said there are 2 reasons for the change. One is that public health can't actually make testing mandatory, and the second is that a single test given in the middle of the quarantine period seemed to be effective enough. And that's all fine. But today you've introduced mandatory testing for rotational workers, and those workers must get not 1 but 2 tests or face the fines. Wondering, why can you make testing mandatory for workers but not students, and why is it 2 tests instead of 1? Like, it seems there's one standard for students and another for workers.
So my answer was not that we couldn't make it mandatory, but to make it mandatory, you need to be able to back up that mandatory with some kind of an enforcement process. Much more difficult to do that with the resources we have with students. The other piece is that it's different. Students are coming here one time for a term. What we need to, the most important thing to do, focus on those students, is have a 14-day quarantine. Adding testing is a supplement to that, but the most important thing is quarantining. With rotational workers who are coming in and out, by definition they're rotational, it becomes much more important that we actually have them tested each time they come in. So that's why it's not that we can't make mandatory for students, but all the other reasons around that, I'm comfortable saying we don't need to have a mandatory approach for students, while we do need to have a mandatory approach for the rotational workers, because they're fundamentally different things we're trying to accomplish.
Remember, workers had a modified isolation, as Dr. Strang is describing. This is us working with those Nova Scotians who find employment outside of the Atlantic region to give them some level of freedom with their families when they get home. But the trade-off to that is getting tested. And they haven't been to the degree that we believe is appropriate. They will be fined if they choose not to. As Dr. Strang just said, university students and others who come into this province have to isolate for those 14 days. Those are very, very different circumstances. We're trying to work with rotational workers and their families. We just need their support.
Go ahead, Kyle, with your follow-up.
Okay, thanks. And thanks both of you. That's very helpful explanation. Now about another type of traveler. Is Nova Scotia ready to deal with travelers who've already gotten vaccinated elsewhere? I spoke with a snowbird in Florida who got the first shot of vaccine last week down there, and now they're awaiting their second shot. So once they're fully vaccinated, will they have to quarantine when they get back to Nova Scotia?
Given what we currently know about the vaccine, the answer is yes. We do not yet have data to show that all the efficacy of the vaccine trials to date, both for Pfizer and Moderna, have been the efficacy of 94-95% is based on, that means the vaccine is 94 to 95% effective against against somebody getting symptomatic disease and getting severe illness. What we don't know yet from the vaccine trials, and we will get this over time, is whether vaccination stops people from getting asymptomatic infection. So we still don't know for sure. There's no guarantee yet that even if you're vaccinated, you couldn't be somebody who's asymptomatically spreading the virus. So it's too early. Until we get that data, we still have to have, even though people are vaccinated, they still have to follow all the public health protocols, including a 14-day quarantine for travelers.
Next, we'll go to Nicole Fusecki from The Signal. Go ahead. Nicole, are you there?
Oh, sorry about that. Hi, Dr. Strang, thank you. Which vaccine are you sending to the Northern Zone long-term care facilities?
We'll be going to Moderna vaccine. Will be used in our long-term care facilities.
Go ahead with your follow-up, Nicole.
Thank you. And just to follow up on a previous reporter's question, do we know how many rotational workers are entering the province weekly or monthly from Alberta?
So it's actually hard to get a handle on that. There's no organization. There's nothing that says they declare before they leave their rotational worker. We rely on them doing the safe check-in form. What's problematic for our data folks is to pick out individuals of all the people who sign the form. There may be one person who's going multiple times because they're a rotational worker. So we believe there's a few thousand rotational workers, but we actually don't have a very concrete, defined number of rotational workers.
Next, we'll go to Blair Rhodes from CBC. Go ahead, Blair.
Thank you. Dr. Strang, earlier today, the Prime Minister announced that the federal government has secured more doses of the Pfizer vaccine. I'm wondering, do you have any concerns from a logistical standpoint that Ottawa is going with the more difficult to store, more difficult to transport vaccine, given the concerns or the challenges we face in rolling it out across the province?
No, I'm happy to get as much vaccine as we can get. I think we've shown that we've got a system in place that can handle whether it's ultra frozen, regular like Pfizer, regularly frozen like Moderna, and then hopefully the products that are coming down the pipe that are refrigerated. Each of our hospital sites have all three types or both types of freezers and refrigerators. So we'll take whatever vaccine product we've developed the capacity to deal even with the requirements around Pfizer.
It explains why it's important to set up vaccination stations across the province. And while we get a number of questions about why the delay in the front end, it will be critical, and Dr. Strang and his team have the appropriate freezers all across our province. So whichever vaccine they get, we'll be able to distribute across the province, which is something very different than when we started in the very beginning. So I want to say to Nova Scotians, be patient. Your public health team is working very hard, as they've done since last March, with the focus of your health and safety and ensuring that we distribute this vaccine as quickly as possible and safely as possible, and ensuring the integrity of it as we get it into your arms. So we've continued to work with you, and we will continue to do in the best interest of all Nova Scotians.
Go ahead, Blair, with your follow-up.
Yes, is there, I realize it's only early days, but have there been any lessons learned in the very early stages of this that will perhaps make it easier when the fuller rollout comes along in the subsequent phases of the vaccine distribution?
So I think everything we're doing, we're learning. As we used the example last week, we were figuring out how do we ship the Pfizer vaccine from the bio depot in Burnside to Northwood. The team that was doing that thought they had it figured out. They trialed it, shipped everything over except the vaccine. It didn't work. So they tried a couple of other approaches till they found something that does work to maintain the temperature. So that's a key point. As the Premier has pointed out, as I pointed out last week, everything we're doing during this first phase, it's getting vaccine, is two key things: getting vaccine into our highest priority groups, but also trying a number of different ways, whether it's different ways that we have to ship and handle safely the different vaccine products, whether it's trying different types of vaccine delivery methods, all of which we will learn from, which we will then make us ready when we get large amounts of vaccine in the spring. We don't have to figure it out once we get it. We have done the work now in phase 1, so when we're ready to go with much larger amounts of vaccine, we can do that. So everything we're doing is about learning how we do this, trialing things, learning from those trials, making ourselves more efficient as effective, and every week we're doing that.
We'll go to Alexa McLean from Global. Go ahead, Alexa.
Hello, thank you. I'd like to momentarily shift gears to another public health crisis that Canada has been grappling with for many years. Dr. Strang, you'll know well, the overdose crisis in Canada. 2020 saw historic rates of drug overdoses nationwide. And indeed, some parts of Canada saw higher overdose rates than COVID-19 deaths. And preliminary data for Nova Scotia forecasts the same thing. Between January and November of 2020, there were 96 confirmed and probable OD deaths in Nova Scotia. And I'm just wondering why there hasn't been any provincial press releases about these numbers. I understand that some of these deaths are still being investigated. We still don't have the total OD number for 2020. But a press release could easily state, where things are as of now. I'm just wondering why there hasn't been any releases to the public about this.
So we continue to release that information within the health system and to community groups like our needle exchanges, and just in the last couple of weeks we've had drug alerts that come through my office that then go out to community groups. So we haven't done the releases to the broad public, but I'm certainly comfortable that those who are on the front lines dealing with this, as well as our mental health addictions clinicians, they're all well aware of the information. I do want to point out that we actually, we'll wait to get our December data for the full 2020 data, but we've actually had a decrease in opioid-related overdoses. What we've had an increase in is in overdoses related to stimulant type of drugs, such as cocaine, which are much more difficult to manage because our approaches around naloxone, et cetera, don't actually work as well, aren't effective for other type non-opioid drugs. So it is complex. We still have lots of work to do. The data that you're talking about is going to those, though I believe, who need to know it, who are on the front lines.
Go ahead, Alexa, with your follow-up.
I appreciate that the front lines are receiving the data, but not everyone across Scotia is accessing community groups and mental health addiction. So that's why I asked the question about why a broader release didn't go out. I'd like to shift gears now to an internal report that I've come to gain knowledge of recently. It's compiled every month by the health department. It details at great length what communities across the province are witnessing with overdose numbers and illicit substances that are concerning. I've been told that this is an internal report that's not shared publicly because there are risks of identifying vulnerable individuals, but folks I've talked with, drug policy advocates, Health Law Institute members at Dalhousie, they say that it's actually more harmful not to share this very concise and detailed information with vulnerable people who use substances and their families, et cetera. So will there be any consideration to make these internal reports available to the public? I mean, they're put together every month, they're concise, they're easy to digest. It seems a lot easier to get information through these reports than multiple government websites.
So, I mean, there are people in my team that are looking at that, small numbers. I have to tell you that, we continue to pay attention to this issue, but all of us have been working most of our time on the COVID response. It's fine from people from Dalhousie to give their opinion, but we actually have legislation that governs and that requires us to protect people's private health information as well. So there certainly are discussions ongoing, based on the questions such as the ones you're asking about. Are there things that we could release more broadly? But at the end of the day, we have to be very careful that we are not disclosing people's private health information.
That's all the time we have for questions today. Just a reminder to reporters on the line, this is a COVID briefing. Please try to keep your questions to COVID. Thank you. Go ahead, Premier.
Thank you, Tina. I use this time often at the end of our news conference to say thank you to everyone. To our healthcare workers, to Dr. Strang and his team, to our department who have been supporting the COVID response, to our teachers, principals, students, and parents, and to all of you, I want to say thank you. I sit here before you today, and I'm very thankful for how hard all of you have been working to keep the cases in our province low. We are not out of the woods, and we need to continue to work together to keep our numbers low. But as I look across the country at the explosion of new cases that have hit so many of our other provinces, I can't help but feel gratitude towards all of you. To everyone in this province who's working so hard to slow the spread, I want to say thank you. I feel for our friends and family living and working in some of the other provinces. I feel for my colleagues who are trying to deal with it. Let's all today think of them with kindness in our hearts. And if you have a loved one who lives in another province, reach out. Tell them you are thinking about them. Tell them to hang in there. Tell them to be strong. And show them a little kindness because it goes a long way.